Good day, Warren County. This age of uncertainty continues as we together meet the challenges of the COVID-19 crisis facing our community. We now have 4 reported cases with tests awaiting results that will come in later this week. Upon the recommendation of the Tennessee mayors and our medical community across the state, Governor Lee issued Executive Order 27, extending the stay-at-home order until the end of April. I've extended my Emergency Order 4 for another week and will be renewed accordingly to reflect the wishes of the state and the governor. I continue to have constant conversation and communication with Washington and Nashville, giving local input and sharing concerns that we have as elected officials. Daily conference calls keep me updated on ever-changing conditions. This pandemic is not over. We should not feel comfortable in what we're doing on a day-to-day basis. Current numbers are not where we want them to be. We should take caution, heed all the CDC and public health recommendations that have been issued, and never let our guard down and stay the course. Citizens, please continue to use social distancing, wear your mask in public, and limit unnecessary travel and trips and purchases. Businesses, please take all measures of caution in protecting our employees and honoring the governor's mandate for closure of all essential businesses. Local government will continue to offer essential services, but we will take all measures to protect our employees. Offices will continue to be closed to the public, but residents may call any individual office for directions or information on the services that are available. I appreciate all our dedicated employees, both with the city and the county, that have continued to work through this process, through this pandemic, through this crisis, and continue to serve the public. We're looking now at sanitation operations, so be prepared for some changing hours and conditions at our service centers. There is exceptional behavior that should be recognized. Many businesses have gone the extra mile and taken extra precaution, not only for their employees, but also for the customers at large. Those folks should be commended. Shout outs to all of our food chain suppliers, our delivery men, our postal service employees, UPS, FedEx, everyone who has continued to keep things normal and provide for our needs in that supply chain. Our front line of defense, which is our law enforcement, our EMS, our hospital and medical employees, first responders, those should all be commended and have shout outs because their service is important to all of us. Despite some of the reports of a DF report card that's been publicized by the media, the number of phones used to provide that data does not provide a clear picture on the efforts that we have done to honor the governor's mandate and those that have come from the White House. Paramount that we ensure the safety and security of all Americans, all Tennesseans, and all Warren County residents. It is our duty and responsibility to do and to heed that advice. Sunday was Easter. It was a surreal time for most of us, but reflective of the days of Passover and the plight of the Jews in Egyptian bondage. Most of us sheltered at home, did our own means of worship, and prayed that the scourge would pass us by. When you consider everything that has gone on, we all know that churches will again rebound, and the hope of a restoration of faith across this nation will bring us all closer together. With all things said, the Safer at Home executive order by the governor will continue until April 30th. There is no clear timeline on when that mandate will be lifted, but a transitionary period is currently being planned. In the meantime, we will analyze the numbers, focus on safety of all residents, and we rebuild our lives and restore our economic vitality in the most responsible way in the next weeks to come. I want to introduce some members of my preparedness team who will share some important updates with you today. We will have Mayor Ben Newman from the City of McMinnville, River Park St. Thomas CEO Dale Humphrey, and State of Tennessee Upper Cumberland Regional Medical Director from the Department of Health, Dr. Don Grisham.
Thank you, Mayor Haley. Thank you, Ben Lohman, for having us here. I'm Ben Newman, Mayor of McMinnville, Tennessee, and this is a very difficult time. As Mayor Haley said, a lot of confusion goes on still, even though we have a lot of people that are following the governor's orders and our city requests and county requests as well. I'd like to thank the people that are following these orders and doing their part. We have 4 cases now confirmed in Warren County. That's just the 4 cases that are confirmed. There may be more. Obviously, we don't know that. We just have the 4 confirmed. I think a lot of what people are doing with social distancing, staying home when necessary, or only getting out when necessary is really helping. And this isn't over yet. The governor has extended his orders for another couple of weeks towards the end of April. So he's still taking this seriously, as should you. So please heed the warnings and the requests of our health experts, of our governor, Mayor Haley, and myself, because these things are important. If we all do this together, because we are in it together, things will get back to normal more quickly. You can still leave your house for essential activities and essential travel, but please do so with caution. There's no need to go to the grocery store every day. There's no reason to leave your house to go to some place of business every single day. Try to limit those. If you need something at the grocery store, try to get the things that you need in one trip and don't make several trips. I have to work on my own father with this type of thing. So I know that there are other people that are doing the same thing. My wife, Ashley, tells me when she's gone to the grocery store, she's seen families getting out of a vehicle and all of them going into the grocery store. That's just unnecessary. Please don't do that. Just limit your contacts with others. There's no reason to take your entire family into the grocery store. If you all want to go in the car together, that's great. But only one of you needs to go in. Leave somebody out in the car with the kids or leave them at home. When you do go out, make sure to wash your hands. Wash your hands when you get back in your vehicle if you have some hand sanitizer. When you get home, make sure to wash your hands really well after you've been out touching surfaces. Those are just some things that you can do to help. We have parks in the city that are beautiful. They're still open. Use those at your enjoyment. Get out and walk. It's beautiful out. The dogwoods are in full bloom, and I just haven't seen a prettier spring than we have right now. So please take advantage of getting outside, walking around, get to our parks, get on the sidewalks, but do so safely. Keep in mind that our playground equipment is closed, and that's for your protection. That's a surface that a lot of kids touch, and a lot of kids can spread those germs very quickly. So we have, out of caution, closed those, but our parks are open otherwise. The staff of the City of McMinnville, for the most part, is working from home still. As necessary, people that can't do their jobs at home are getting out to do the things they have to do. We still have police that have to do their job to keep us safe. We have our firemen that are doing their job to keep us safe. Those things are uninterrupted. Most of our other city services are still going on. You can still pay your bills online. You can pay your water bills at drop boxes. And McMinnville Electric has ways to pay online and at a drop box at their office as well. But our lobbies are closed. Many people are stressed out during this time, either financially stressed out because they can't see family members as much or friends as much. So just be understanding as you can that people are stressed out. You may be stressed out yourself, and that's okay. Other people are in the same boat as you. We will get through this together, and with your help and patience, we'll all get through this. Businesses will bounce back. People will be back to full employment once this is over. There are things in place and things that are going to be put in place to help people who have gone without work. There's unemployment now, which has gone up from $275 maximum per week to, I think it's $875 maximum per week now that you may be entitled to if this has affected you. TN.gov is a place that you can go for some good resources. Also, we have some resources at McMinnvilleTN.gov on our city website for some updates. So again, thank you for what you have been doing. Continue to do it, and if you're not taking this serious, please do. Please stay at home unless necessary to leave, and limit your trips for when you do have to go out. We are in this together. We are the volunteer state, and I think that we're doing a good job. We just need to keep it up. Thank you very much for your attention.
Good morning. Dale Humphrey from St. Thomas River Park Hospital. I'm here today to give you a status update to you regarding the status of our hospital. The positive news to report is the fact that social distancing, hand washing, wearing masks in public, and sheltering in place have so far prevented a huge surge that would potentially overwhelm our hospital and others. Our predicted peak in Tennessee is April 19th. And due to flattening the curve, current estimates predict that we will have adequate ICU beds and ventilators available to handle the predicted volume of COVID-19 patients. Your personal efforts have allowed those of us in healthcare the time needed to move from a defensive stance to more of an offensive position. St. Thomas has increased our days on hand supply of personal protective equipment, increased the number of ventilators available, shortened the turnaround time for COVID-19 test results to around 24 hours. And tomorrow, St. Thomas will begin a process of testing that will provide results in about an hour's worth of time. In addition, St. Thomas Health, including River Park Hospital, is enrolling in a research protocol with the Mayo Clinic and the Food and Drug Administration to obtain convalescent COVID-19 plasma for our patients. Medical experts believe that this has been shown to improve outcomes when administered early to hospital patients early in their stay when they develop difficulty breathing, and hopefully this can avoid intubation and ventilator dependence. As of yesterday, the hospital had performed over 100 COVID-19 tests, and to date, those have all come back negative. Warren County currently has 4 confirmed positive COVID-19 patients in the county out of the 242 that have been tested so far. We appreciate your continued patience and diligence in assisting our community in slowing the spread of the virus. I'd like to remind you again that it only takes one ill-advised gathering to expose a large number of people to exposure. And nationally, we have only tested less than 1% of our population. Tennessee is a little bit better, about 1.1%. However, there is still a large unknown out there. Again, I want to thank you for those that have provided food, encouragement, and prayer for the safety of our hospital staff and first responders. Thank you, and God bless.
I'm Don Grisham with the Department of Health. George Stephanopoulos has COVID-19. He was diagnosed this week and announced that from his New York home yesterday. He's one of 2 million people that have COVID-19 worldwide. When asked about his symptoms, he said, "I feel fine. I don't cough, I don't have fever, I don't have shortness of breath, I don't have body aches." He was tested because his wife was diagnosed 2 weeks earlier. So the point is there are many faces of COVID-19. You can feel fine and be asymptomatic and have the virus, or you can be deathly ill and have the virus. The encouraging thing is that if you do get COVID-19, there's an 85% chance that you will recover completely from it. Most people say it's like a bad case of the flu, but the point in today is to be tested. Just 3 long months ago, the United States obtained its first case of COVID-19. Since then, in 3 months, we have over 500,000 cases, and over 20,000 people have died from it. Just 6 weeks ago, Tennessee had its first case, and now we're approaching 6,000 cases across the state, and over 100 Tennesseans have died. Upper Cumberland has had 210 cases, that's 14 counties and 3 deaths, and Warren County, as mentioned, has had only 4 cases in the last 2 weeks, which means 4 people have been identified, but there are people that have the virus and are not aware of it. Your county executive has been incredibly proactive from the very beginning. He's contacted the Department of Health, local mayors, and the governor to get you ready for this. Governor Lee has extended his stay-at-home order because it's working. In the last 10 days, the amount of new cases has leveled. So we're hoping it's plateauing and eventually will go down. But the point is, testing is widely available through the health department. It's free. You can sit in your car and they can test it. There are tests available online that you can purchase, which are not reputable, and a lot are not FDA approved. We have seen clusters of cases in the Upper Cumberland. A group went to out west skiing and a bunch became infected. There was a nursing home that 50 people were infected. So it's widespread. You can be asymptomatic and still have the illness. Let's say you go to the Warren County Health Department and you're tested. If you're having no symptoms, but they call you and say your test was positive, then you're required to stay at home for a week. And it's a self-quarantine. We will contact you to make sure you're doing well. But if you go by there and you're having fever or cough and you're tested, then you're self-quarantined for at least a week, a minimum of a week, but the last 3 days you have to be completely well. So in other words, if you get the illness and 4 days later you're feeling well, you have to stay at home 3 more days. If you get the illness and on day 6 you're feeling well, 3 days after that you have to stay home until you're completely over it. So how do you get tested? You can go by the Warren County Health Department from 9 until 3. You can stay in your car, and it's a free event. There's going to be scheduled a larger event at a different site on a later date. Okay, so what if my wife has COVID-19 and I don't? What do? I stay at home, self-quarantine for 14 days, and then I'm free to go. If I'm an essential worker, like in healthcare, I can go to work if I have no symptoms, but I have to wear a mask. So the take-home points are: you wear a mask in public, you wash your hands, you have to remember that you're safer at home, and that you can get tested for free at the health department.
Good morning. I'm Bobby Cox, the Warren County Schools. I'd like to bring you just a brief update on the school system and academic performance, how we're, our academics and how we're delivering academics at this time, our feeding program, and then a little bit of information on the balance of the school year and where we are to date on that. So with academic programming, we have been developing lessons for students that are online mostly. We have not started handing out any kind of paper packets because we don't want people gathering, and that we feel like that might continue to help spread the virus. So everything that we've developed now has been online. We've also partnered with our BLTV station, Warren County Schools Television, channel 180. If you're on BLTV, then you can go and tune in, and we've partnered with the State Department of Education and PBS. So we have programming there for English and math that has started delivery this week. So we'll continue to broadcast those programs throughout the outage that we have currently. You can go to our website at warrenschools.com. There's a great deal of resources for parents, for counselors, for special education students, for ESL students. So we're continually updating our website to make sure that we have information for you there. So I would encourage you to go there and get the most updated information. Our feeding program, we continue to operate our feeding program. Yesterday, on Monday, we gave out over 10,000 meals, 5,000 plus breakfast and 5,000 plus lunches for Monday and Tuesday. We've averaged around 10,000 each day, and we'll continue to operate our feeding program Monday, Wednesday, and Friday. We have 6 sites on school campuses. We have 3 sites that are off of school campus, and we're running 10 bus routes currently. So if you need information about that, again, on our website, those bus routes and times are listed, as well as the locations for grab-and-go pickup. So again, that'll be Monday, Wednesday, and Friday from 11 to 1 each day, and we'll provide 2 days of meals, both breakfast and lunch, for each time we have on Monday, Wednesday, and Friday. As we continue to go through the end of the school year, yesterday Governor Lee, with his extension to April 30th, did not mention schools at that time, but he did mention that on Wednesday of this week at his press conference, he will provide more information for schools. I would assume that since we are under the executive order, that schools would be continued along with that, but we'll confirm that information on Wednesday of this week, and hopefully we'll know if we're going to continue to be out for the rest of the school year. Some of the questions that we've had are about graduation and prom, especially for our seniors. Those have not been canceled at this point in time. With the continuation of the executive order, I assume that we will probably have to move those dates. I've been in contact with Mr. George this morning, and we're looking at alternative dates for that. But I can promise you that if you're a senior, that there will be an opportunity for a prom and there will be an opportunity for a graduation. We just don't know the date and time of that yet, but as soon as we have those plans in place, then we will get those out to you. So again, all of our offices are closed. We have phone service and email service, so if you have questions, please feel free to go to our website, email, or call, and we'll return that phone call. I want to echo what Mayor Haley and Mayor Newman has mentioned. Please continue to be vigilant. Please continue to social distance, and we'll get through this virus together. Thank you.
Thank you for the opportunity to serve as your county executive during these trying times. With the support of our community and the help of my preparedness team, the challenges have been great, but still, they have aided and abetted all the actions that we have taken from elected officials through all the public health departments and all of our community-involved agencies that have stepped up and done the feeding programs and been our front line of defense for this crisis. I want to thank the media, in particular BLTV, for providing this opportunity for us to get our message out to the public in a very generous way. Also for the radio and the other media outlets that have been very, very helpful in dispersing information that's pertinent to our survival as a community. Supplies are coming. I was on the phone with TEMA last week. We've had limited supplies coming in, but those supplies will be here, and they are crucial to the front line of defense that we have for those people that are out there as law enforcement, health agencies, and our public health providers, first responders, our firemen, all of those EMS, those people need those supplies desperately, but TEMA says they are coming. The money is also coming. So the federal government has promised in this CARES Act that the money will be flowing in, and a few people have already received checks. The timeline is not yet established on when everyone is going to receive and when businesses will start collecting, but we are working on that and we will disperse that information. In the meantime, if you will go to the cities and counties websites, state and federal websites, that information is out there, and you can always direct calls to my office if you have additional questions. One important thing that we do need to address while people are at home sheltering and trying to provide the safer at home environment for your families and friends and for your businesses, the census is important. And so this census, which kicked off on April 1st, we've got to count every single resident in our county, every single resident in the Upper Cumberland, every single resident in Tennessee, and this nation. For one important thing, the federal food programs that the school system is providing now, these 10,000 meals, much of what we are providing as a community comes from the census and those numbers. So it's crucial for federal funding, for representation in Congress, for all that we do as a community and as a state, as a nation. So please, please fill out the census, complete the forms. It takes very little time, but it's crucial and important that we do that. I still have a few concerns. We've reiterated that with my preparedness team today. Social distancing, don't let your guard down. Please heed all the advice from the CDC and the public health officials, the social distancing, the masks, the hand sanitizer. Do everything possible to protect yourself and your family. Try to have a healthier lifestyle. It's very easy to sit at home and eat potato chips and drink sodas, but if you exercise, eat healthy foods, green and leafy vegetables, mushrooms, fresh fruit, exercise, get plenty of rest, those things will aid and abet your immune system and allow you possibly to not have these conditions or whatever affect you and your family. We're still going to continue to provide as many essential government services as possible, so both in the city and the county. So please be patient, call those offices if you have questions. But now we have to look at the next step. Whatever we do, wherever we go with this, we must coordinate health and economic restructuring locally, both to protect ourselves as we emerge successfully after this shutdown. We have to rebuild our local economy from the ground up. There's no way to fathom just where we're going to go, when this normal is going to return, or what the timeline is going to be to resume business as usual. In discussions with the governor, and I'm doing this locally as well, we are both creating an economic recovery group to assist in trying to get input and information back from across the community for business and industry as we transition back into rebuilding our business community and still providing the health standards and the safety measures taken to make sure that this outbreak does not reoccur down the line somewhere. We are currently surveying business and industry for short-term and long-term needs, and how we can work together and collectively as we focus on what is best for our community here in rural America and the Upper Cumberland. In the meantime, I want to thank each and every one of you for your cooperation and support. The great unknown still looms ahead. We take each day seriously. It's better to be safe than sorry. It's better to be over-prepared than under-prepared. It's better to be proactive than reactive. It's better to have a plan than ill-prepared actions that take us nowhere. It's better to have solutions than excuses. As Churchill once said, this is not the end. This is not the beginning of the end. Perhaps this is the end of the beginning. Together, we can do this. Together, as a community, as a business environment here in Warren County, we can rebound, we can regain lives, and we can restore our faith in what we do as a community, as a state, as a nation. Together, we are Warren County strong. Thank you.